I'm Andrea Nguyen, a PA who has been working in dermatology for 14 years, with a particular focus on non-segmental vitiligo. Today, we're going to discuss a case study of a recent non-segmental vitiligo patient of mine, Alexis, and his journey to repigmentation. Alexis is a young male who had non-segmental vitiligo for some time that was very prominent on his face, which is common for patients. At his initial assessment, or any initial assessment, I ask about history, how quickly the depigmentation progressed, and if there are any other areas where the patient is noticing depigmentation. He came in because he noticed he had lost color and expressed concern when it started to expand and how much he depigmented. He was frustrated with his lack of progress with other options and mentioned noticing a shift in how people interacted with him. I told Alexis that OPZELURA is a steroid-free option indicated for the topical treatment of non-segmental vitiligo in adult and pediatric patients 12 years of age and older, with the limitation that use of OPZELURA in combination with therapeutic biologics, other JAK inhibitors, or potent immunosuppressants such as azathioprine or cyclosporine is not recommended. It's really exciting for patients because it's the first and only FDA-approved option for repigmentation. It's very important to tell patients like Alexis that repigmentation takes time. You have to be consistent by using OPZELURA twice a day. You'd be doing yourself a disservice by not being consistent. You might not see improvement. Make a routine. Set an alarm, do it when you brush your teeth, and keep it somewhere you'll see it, like your nightstand. I sometimes have patients come in whose expectations weren't set before starting the treatment, so I make sure to set or reinforce expectations with all my patients. This is so important because in my experience, without understanding what to expect, patients may give up. In the clinical trials, some patients began to see results in 3 to 6 months, and others took a year or longer. Setting expectations helps patients keep going, especially when I remind them that they may not see any changes in 1 to 3 months. I would have 6-week check-ins with Alexis where we would talk about his progress and look at his photos. I find once patients start to see progress, especially in photos, they're more motivated to continue. Alexis didn't convey extreme distress during his first visit, but when he started to see progress, he was encouraged by his results. At this visit, when I walked into the exam room, Alexis smiled at me. But it's really those small things that really show how patients feel about their progress. That's why photos are so important. Some patients can have very gradual progress when I see them for follow-ups every 6 to 8 weeks. Alexis first began seeing progress in that 6 to 12 week mark. We looked for islands of perifollicular repigmentation or any marginal patterns, and he had some nice marginal repigmentation around the week 20 mark. OPZELURA has long-term data that suggests that patients who go past the 6 to 12 month mark may see repigmentation at later time points. I've seen it from my patients in my own practice. Refills are a good way to know if patients are being consistent. I had a patient I inherited from another clinician who was using a tube that was 1.5 years old. I told him it's not working because you're not using it as prescribed. You should be refilling monthly or every other month. I always remind my patients to check if they're eligible for the copay savings program, because they may be able to get OPZELURA for little to no cost. I tell patients, if your vitiligo bothers you enough that you're seeking treatment, you owe it to yourself to be consistent. I prescribe OPZELURA for my appropriate non-segmental vitiligo patients because it's the first and only FDA-approved treatment for vitiligo repigmentation. It's my go-to product.
Indication. OPZELURA is indicated for the topical treatment of non-segmental vitiligo in adult and pediatric patients 12 years of age and older. Limitations of use. Use of OPZELURA in combination with therapeutic biologics, other JAK inhibitors, or potent immunosuppressants such as azathioprine or cyclosporine is not recommended. Important safety information. Serious infections. Patients treated with oral Janus kinase, JAK inhibitors for inflammatory conditions, are at risk for developing serious infections that may lead to hospitalization or death. Reported infections include active tuberculosis, which may present with pulmonary or extrapulmonary disease, invasive fungal infections, including cryptococcosis and pneumocystosis, bacterial, viral, including herpes zoster, and other infections due to opportunistic pathogens. Avoid use of OPZELURA in patients with an active, serious infection, including localized infections. If a serious infection develops, interrupt OPZELURA until the infection is controlled. Carefully consider the benefits and risks of treatment prior to initiating OPZELURA in patients with chronic or recurrent infection. Closely monitor patients for the development of signs and symptoms of infection during and after treatment with OPZELURA. Serious lower respiratory tract infections were reported in the clinical development program with topical ruxolitinib. No cases of active tuberculosis (TB) were reported in clinical trials with OPZELURA. Cases of active TB were reported in clinical trials of oral JAK inhibitors used to treat inflammatory conditions. Consider evaluating patients for latent and active TB infection prior to administration of OPZELURA. During OPZELURA use, monitor patients for the development of signs and symptoms of TB. Viral reactivation, including cases of herpes virus reactivation, e.g., herpes zoster, were reported in clinical trials with JAK inhibitors used to treat inflammatory conditions, including OPZELURA. If a patient develops herpes zoster, consider interrupting OPZELURA treatment until the episode resolves. Hepatitis B viral load, HBV DNA titer increases, with or without associated elevations in alanine aminotransferase and aspartate aminotransferase, have been reported in patients with chronic HBV infections taking oral ruxolitinib. OPZELURA initiation is not recommended in patients with active hepatitis B or hepatitis C. Mortality. In a large, randomized post-marketing safety study in rheumatoid arthritis, RA patients 50 years of age and older with at least one cardiovascular risk factor comparing an oral JAK inhibitor to tumor necrosis factor TNF blocker treatment, a higher rate of all-cause mortality, including sudden cardiovascular death, was observed with the JAK inhibitor. Consider the benefits and risks for the individual patient prior to initiating or continuing therapy with OPZELURA. Malignancies. Malignancies were reported in patients treated with OPZELURA. Lymphoma and other malignancies have been observed in patients receiving JAK inhibitors used to treat inflammatory conditions. In RA patients treated with an oral JAK inhibitor, a higher rate of malignancies, excluding non-melanoma skin cancer, NMSc, was observed when compared with TNF blockers. Patients who are current or past smokers are at additional increased risk. Consider the benefits and risks for the individual patient prior to initiating or continuing therapy with OPZELURA, particularly in patients with a known malignancy. Other than successfully treated non-melanoma skin cancers, patients who develop a malignancy when on treatment, and patients who are current or past smokers. Non-melanoma skin cancers, including basal cell and squamous cell carcinoma, have occurred in patients treated with OPZELURA. Perform periodic skin examinations during OPZELURA treatment and following treatment as appropriate. Exposure to sunlight and UV light should be limited by wearing protective clothing and using broad-spectrum sunscreen. Major adverse cardiovascular events, MACE. In RA patients 50 years of age and older with at least one cardiovascular risk factor treated with an oral JAK inhibitor, a higher rate of major adverse cardiovascular events, MACE, defined as cardiovascular death, myocardial infarction, and stroke, was observed when compared with TNF blockers. Patients who are current or past smokers are at additional increased risk. Discontinue OPZELURA in patients who have experienced a myocardial infarction or stroke. Consider the benefits and risks for the individual patient prior to initiating or continuing therapy with OPZELURA, particularly in patients who are current or past smokers and patients with other cardiovascular risk factors. Patients should be informed about the symptoms of serious cardiovascular events and the steps to take if they occur. Discontinue OPZELURA in patients that have experienced a myocardial infarction or stroke. Thrombosis. Thromboembolic events were observed in trials with OPZELURA. Thrombosis, including pulmonary embolism, PE, deep venous thrombosis, DVT, and arterial thrombosis have been reported in patients receiving JAK inhibitors used to treat inflammatory conditions. Many of these adverse reactions were serious, and some resulted in death. In RA patients 50 years of age and older with at least one cardiovascular risk factor treated with an oral JAK inhibitor, a higher rate of thrombosis was observed when compared with TNF blockers. Avoid OPZELURA in patients at risk. If symptoms of thrombosis occur, discontinue OPZELURA and treat appropriately.
Cytopenias. Thrombocytopenia, anemia, neutropenia, lymphopenia, and leukopenia were reported in the clinical trials with OPZELURA. Consider the benefits and risks for individual patients who have a known history of these events prior to initiating therapy with OPZELURA. Perform CBC monitoring as clinically indicated. Discontinue OPZELURA if signs and/or symptoms associated with clinically significant decreases in laboratory values occur.
Lipid elevations. Treatment with oral ruxolitinib has been associated with increases in lipid parameters, including total cholesterol, low-density lipoprotein, LDL cholesterol, and triglycerides. Adverse reactions. The most common adverse reactions, greater than or equal to 1%, are application site acne, application site pruritus, nasopharyngitis, headache, urinary tract infection, application site erythema, and pyrexia. Pregnancy registry. There is a pregnancy registry that monitors pregnancy outcomes in pregnant persons exposed to OPZELURA during pregnancy. Pregnant persons exposed to OPZELURA and healthcare providers should report OPZELURA exposure by calling 1-855-463-3463 or visiting www.opzelura.pregnancy.insight.com. Lactation. Advise women not to breastfeed during treatment with OPZELURA and for approximately 4 weeks after the last dose. Approximately 5 to 6 elimination half-lives. Please see the full prescribing information, including boxed warning and medication guide at opzelura.com.